So welcome to week 2. It's going to go by very, very quickly. So week 2, you did the quiz already. Most of you did amazing. Good job. Anybody who wants to know that one or two question they got wrong, I have no problem. You quick meeting with me. You want a quick meet right after class, just let me know. I have no problem doing that. Um, but it's next week because there's still some quizzes going on this week. And there's a quiz bank. So it could go on to another student. Um, you also have a discussion question. I've already graded discussion question 1. Even if you got a 20 out of 20, please go look at comments. I do put comments on every single thing that you turn in like that. So it'll give you extra information, or maybe I responded to what you said. So please check your comments. If you got an 18, most likely you did not cite in the body of the paragraph. For instance, if you used our book, Perry et al., you would have in parentheses, Perry et al, comma, 2023, at the end of a sentence within the paragraph. And that shows me where did you get the information from. If you don't understand that, I can meet with you. Or there's a great site that even I used as a brand new person going back, not understanding what APA was. What does that mean? Anyway, it's Purdue Owl, Perdue Owl, OWL, and it can cite things and do things automatically. If you want to do it that way, whatever you want to do. Most of you I know are probably going to go on for your higher level degrees. What is a BSN? What's an MSN? Papers, brochures, picture boards, projects, all about writing, all about APA. So it's something that if you're going forward, you're going to have to do and do it the best you can. I'm here to help you. I didn't know how to do it when I started. I didn't know what APA meant. So I can help you and make it very simple. As John was saying, next week we are going to be doing our reviews. I just got back the last person of all of the 6 other professors in pediatrics, and they go me on Wednesday, Morris on a week from Sunday, Arstenstall on Tuesday, Pace Chismar on Wednesday at 5:30. I do mine at 4. Dr. Gullett on Thursday, 3 in the afternoon, and Luminoso at 6 on Friday. So it's all over the place. Now, as soon as I get those recordings, as I was saying, it'll be in one place and it will say the title, Exam Review Recordings. And the first thing will say, I will update when a new review comes in. As I think you've got 3 courses, you're not going to look for 6 different professors 6 different, announcements. That would drive me nuts. I keep you organized. Also, when I send you when these reviews are, I'm going to be sending you all your Kahoots will be right in there. And you are going to get a study guide, which I have just completely revamped from last quarter. It's newer, so you also will have that there attached, all your information in one place. Kahoots are a great review. Those concepts you will hit on the exam. So make sure that you do look at them and understand them. Have your book open. Oh, I don't get it. Let me look it up. Okay. So today what we're going to do is going over infants, toddlers, preschoolers, and we're going to be doing a Kahoots. It's like 63 questions, but infants in particular in this exam is hit hard. And why? Don't they do the most developmental changes in the first year of life? They go from not lifting a head up to walking and talking by 1-year-old. So there's a lot of things there that they do cover. So just to let you know that. Any questions? Remember, yes?
I just said, let's go.
Okay, let's go. Good. Remember, as I'm going through this, you're not understanding, please just stop me. I don't mind being stopped. If you have a question, I'm sure somebody else does. Or if you have something to infer, about something about the subject, please and let's talk about it. It's not a problem. I don't mind. I encourage it. Okay.
I have a question.
Sure. Go ahead.
Where can I find this PowerPoint?
This should be attached to the announcement that says week 2 information. I will
Oh,
also
I see it at the bottom. Thank you.
Also, when I do the week 2 recordings, it'll be attached there again, along with the cahoots. So I try to put it in a lot of places because sometimes you just can't find it. So the more places I put it, the more I have to find it. Okay. So I do that to try to keep you organized. So let's go with infants. Well, as I was just saying, these are incredible beings. I love working with infants. They start out where they can suck, swallow, and breathe. And even that's a hard thing, right? We know that they go from, if you just look at gross motor skills, they go from not lifting their head up. By 3 months, they're lifting their head up. By 6 months, they're turning completely over, front to back, back to front. By 8 months, they're sitting unsupported. And by 12 months, they're saying at least one word, mama, dada, milk, more, something. And then they're also attempting or they're walking. It's quite incredible how quick that happens, as in most dramatic. The one thing that we see is the gain in weight. Now, we monitor height and weight, and you're going to hear me say this repeatedly during this class. Height and weight are very important. Not only does it look at nutrition, that they're getting proper nutrition, what other body functions do that are affected by that you would see the differences in height and weight? Things like thyroid, right? Things like growth hormone, pituitary gland. So looking at height and weight really tells a big picture. Now, the first year of life, they should double their birth weight by 6 months. If they haven't, we'll increase calories. Find out why. Maybe the mother isn't feeding enough. And let's say it's too much. Well, maybe they're overfeeding. So these are things we'll look at. By 1 year, their weight should triple. Born at 7 pounds, they should be around 21 pounds. And that first 6 months of life, they gain 1 inch per month. Can you imagine how much fuel they need to grow like that, right? Nutrition, nutrition. As they're born, as I said last week, as a neonate, that first month of life, their heart rate is 140 to 160. Respiratory rate, 40 to 60. As they get older, by about 1 year, you might see a heart rate of 100 to 120 at 1 year. You might see a respiratory rate around 30. When we see it too high, too low, that's when we have interventions. Why we need to know about how old they are and why we need to know the differences in vital signs. What if you're given digoxin to an infant? It's not uncommon. You need to know what a good heart rate is, right? That's just one example. Now, babies are born with mom stuff, right? All the good hemoglobin, iron, all her immune system is given to mom at birth. And we know it starts to go away between 3 to 6 months. And the body does not start to make its own until about that time. It's not uncommon to see a 6 month old with hemoglobin hematocrit of 10 and 30. And they could be born with 14 and let's say 52, right? Not uncommon because mom stuff dies and the baby's not making it yet. So not only are they going to have iron depletion, think about the immune system. The immune system also is going to be depleted. Why do you think we give all those immunizations at 2 months, 4 months, 6 months, right? That's trying to get those really bad conditions that we give them that boost of an immunization to prevent it. Now, at birth, heads are big. You learned that in newborn, right? In your labor and delivery class, maternity. When they're born, their heads are huge, their chests are smaller. By about 1 year to 15, 18 months, they should be equal or the head should be smaller, normal, okay? They're born with the soft spot in the front, which is anterior fontanelle, soft spot, that little place where the bones aren't, and in the back, the posterior. Now, the posterior closes about 6 to 8 weeks, and usually there's not a problem with that. But you can either see the one on the top, the anterior, close too quick or be open longer. And either of them could be a problem. And that's why we look for them. Are they closed? Are they open? What could it be? And what's so good about infants and that fontanelle that we look at, you can see fluid balance so quickly. Is it flat? Good fluid balance. Is it peaked up and bulging? That means some sort of pressure. Something's happening, right? Or if it's sunken, we know probably dehydration. It's one of those key assessment spots on your infants. So as they get older and get diseases, we know that immunological system is going to get better and better. We know that breast milk does give a lot of protection. We know that for sure. By 9 months is when now they're making their own real immunities. They're taking those immunizations. They're really starting to work. But you can see there's so many other different things that are there protecting those child. You know what I call them, the cheese babies, right? The vernix caseosa, and it's a protection from the environment. Now, at birth, a baby was in mom, nice and warm, and they have a lot of extracellular fluid. When they come out, the biggest thing is to dry them off quick and get them underneath a warmer because they will go hypothermic very quick. Now, what would happen if an infant, the temperature was too low? They actually go bradycardic. That means their blood doesn't pump the way it should. And I know that because I've seen that with warmers turned off after baths. And all of a sudden, the heart rates would go down. And I go, what's happening? And I'd realize the warmer wasn't on. They needed to be warmer. As that extracellular stuff goes away, they build up their fat tissues. They become more and more able to regulate their own temperatures. Now, prehension is about grasping objects. Now, we have fine motor skills, F fingers, fine, okay? This is all about cognition and figuring out how to work the hands and fingers. And then we have gross motor, and I call it get up and go, 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 like Paw Patrol, which is movement. It starts with the head being picked up, and it goes to walking. So that's how I remember and keep them straight. There are questions regarding both. Is it fine fingers or gross, the movement, get up and go, go? We know we start with that reflex palmar. We grasp mommy's finger and they go, oh, look, my baby hugged me. I'm not going to tell them it was a reflex. Those mothers, are like, oh, my baby loves me, right? And you don't want to stop them from feeling that way. Well, after a while, they look for their rattles and they grasp it, and then they start transferring things about 7 months. And then they start in the high chair. Now they can sit. So they're older than 8 months. So 9, 10 months. You put those little Cheerios or those little puff things in front of them, and they take their fingers and sort of crudely smush it with their fingers. And then it gets to this fine pincer grasp one at a time. That's as they get older. Another thing is removing objects from containers. It's either whether putting them in, taking them out. It's just they have to figure out how to do it. That they're in there, they can put their hand in there and they can pull it out. And that's about 11 months. And then they build a block, 2 blocks by age 1. Now, some kids go far beyond this and some don't. I always say if you have children, forget you have children in pediatrics, okay? Because it's by the book, not what your kids do. And I know that's hard. So that was just a test for you. Gross motor, get up and go, go, go. As I said, starts out with the head, rolling over, sitting, going from their backs, getting up and, sitting. This is all things that happen in routine. Now, if they're not doing what they should do at a certain age, it is us to say, oh, they're not lifting their head up. They're 5 months old, and going and finding out why. Is it some cognition problem or is it nutrition? It's something's going on. So cephalocaudal starts with the head sitting up, and then it goes to walking. That is cephalocaudal direction of development. That's what the infant does. They're crawling about 6 months. They're creeping, means pulling up on the side of a couch and walking around like that. About 11 months, you hold their hands, they're trying to walk. And usually they're attempting or walking by age 1. Now, nutrition, nutrition, nutrition. Now, for the first 6 months of life, it is only breast milk or iron fortified formula. It's the only formula or milk they should have. Nothing else should be given. There are some conditions like reflux. We'll put some cereal in, the formula or the milk to hold that milk down, but they don't get nutrition from that. That's just to thicken it, to hold it down. But usually it's nothing besides that. At birth, one of the things parents have a hard time with, especially if they're breastfeeding. Am I giving the baby enough? Is the baby eating enough? Especially, what if they were in NICU for a couple of days? NICU nurses, we measure everything, don't we? We're going to see the bottle and we can know stuff like that. Well, 6 to 8 wet diapers a day, we know they're getting enough. And we know that if they've gained that 10% of birth weight that they lose, usually the first week, if they're gained it back, we know they're getting nutrition. Again, it's weighing them and knowing they're gaining it back. They're doing well. And you could see they're gaining half an ounce a day for at least 2 months. But remember, they're growing an inch a month also. One of the things with breastfed babies, they do give them also vitamin D, these infants. Now, why don't we feed infants at birth? Well, the reason is that their intestines, their digestive system is very, very immature. It doesn't know how to absorb, break down, and use these nutrients yet. So it is not uncommon to have infants, even at 6, 8, 9 months, where we start to feed them food, having pieces of that food in the stool. Very common. I mean, just think of you and me. Have a corn on the cob. You're going to see some corn, in your stool. So infants, just think of it the same concept. They don't know or can't digest it. That's one of the reasons why we don't start to 4 to 6 months. So the second 6 months, first we do is we start to feed them food. We'll start with usually rice cereal because it's less allergenic than everything else. And we'll wait 4 to 7 days in between adding a new food. Now, what do you start after that? Fruits, vegetables? Usually it's a physician or a parent, what they want to do. Doesn't matter as long as it's one at a time, 4 to 7 days in between each, addition to a new food. Another thing is we should feed them food before we feed them their milk or breastfeed because we want them to get the nutrition and we're starting to wean them off the milk. One of the things they can do at 6 months to start introducing or giving them dairy is a soy-based yogurt. and that has been used a lot. And the infants have been be able to tolerate it. And then at 1 year, we could put them on just whole milk. Now, why don't you put them on a skim milk or a 2%? Well, for their central nervous system, young children need that fat. So even if they're big babies, we will still put whole milk at 1 year. So food sensitivities, we know that there's always problems at times with it. There's allergies. What would you see? Well, it could be diaper rashes, could be spit up, vomiting, diarrhea, abdominal cramping, all the way up to anaphylaxis. So anything could happen with it. Now, one of the words that we see with food sensitivities is atopy or atopy. And that is children who are susceptible to allergies and tend to have a lot. These are children we have to be careful with. These are the ones that are going to end up with allergies, that sinusitis, rhinitis, asthma, dermatitis. So some of the things that we are concerned about, and we'll be very careful if they're sensitive to a lot, what we introduce. There's things that we'll avoid, like orange juice, eggs, peanuts, right? Those things you'll see more allergies to. How do you treat it? Well, if you see an allergy to a food, you stop the food. If you need medication, the physician could do creams, could do Benadryls. If it's anaphylaxis, of course, that's going to be, your epinephrine and whatever other thing they need to stop the food from affecting their body. And then, of course, they're going to try to desensitize so that, or not give them. My grandson is a peanut allergy. His mother never knew and gave him some chicken from somebody as a young toddler, and his whole face swelled up. So he learned how to chew a regular Tylenol pill really quick because he was blowing up quick. So it happens and you see it. Sleep and activity. We know infants usually are awake a little while, nap, wake a little while, nap. And hopefully, after, the first month, they're sleeping for at least 4 hours. We know breastfed infants want to be fed every 2 to 3 hours. It's because it's a more watery substance, less thickened, I think, and they do need it more frequently. And part of the book says walkers, swings, and playpens are not necessary. I used all of them. So again, I think it is a parent choice. Now, dental health, they say infants about 6 months old will start to teeth and have teeth. Not everybody does, as all children are different. They say if the kid is 8 months old, it's 6 - 8 months, they should have two teeth. Now, my kids, my grandson, they never had teeth at a year old, but at 15 months, they got eight. And that's not uncommon too. And so you don't look at one level of development and say the kid's not where he should be. You have to look at the whole picture. So that's teeth. Another thing is when we have kids and we prop things, um, give fruit juices, which are sugar, you can take baby teeth and rot them. They can have what we call a bottle mouth. And what they say is use a toothbrush, soft, or even a washcloth, and just wipe the teeth off before they go to bed, and nothing in bed with them at nighttime. And they say a pacifier is good. Although today there's still parents that don't like them. Immunizations, here's all of them. And when we give them, um, we know that some things we need to understand is Hep B is given at the hospital usually before they go home or at the first doctor visit. And that's usually because that's when the insurance pays for it a lot of time. They don't pay it in the hospital. I've seen that. We know as they get older, they'll get measles, mumps, rubella, and the chicken pox. One of the questions that you might see is about influenza. When should a newborn infant get the influenza shot? And they shouldn't get it until 6 months old. Okay. Colic is something that happens. Usually it's gone away in the first 2 to 3 months, but we know it's all about spasming, pain in the belly. They do all things for these poor children. They give these children, medicine, uh, drops, gas drops. They feed them, make sure that they're burp, sitting, and still they have colic. It's a very difficult situation for parents. We know some kids don't sleep. We know some kids sleep too much. And then there's something else called failure to thrive. And how do we know if there's a failure to thrive? Their weight is not being where it should be. Other things, children today, because of SIDS, are placed on their back to go to sleep and for naps. And many parents say the back of their head is flat, right? And what should you tell a parent if the kid's head is flat? Well, there's something called tummy time, right? And during tummy time should be like an hour a day, that several times, where the child is really awake and alert. You put them on their belly, and these kids' scalps are soft, and they're really will come back to their full form very quickly. I mean, there's some times where it really is flat at one side. They might put a helmet on, like that bottom right-hand picture. Some of the kids get it. And if you've ever seen it, it's because their head had a flat side or something. Common problem, diaper rash, right? I had children who could not wear Pampers, could only wear Huggies. I've had it opposite with other children. Or it could be this sort of lotion, could be the cream, could be the food. So diaper rash, although in itself is very easily treatable, this is something that will keep a baby awake at night. You put them to bed, nice dry diaper, they urinate, they have a stool, it burns. What happens? They wake up. So we try to get that fixed as soon as possible. And sometimes it's yeast. We'll put on the nystatin powder or creams. Some children are born with cradle cap. It could look flaky, could look more than that. How do you take care of it? Well, you wash it like normal, fine tooth comb, you comb it, and then put, I've heard different things like olive oil at night, wash them in the morning, get it moisturized, fine tooth comb is basically the treatment. It's nothing that needs medicine. And SIDS, we talked already a little bit about it. This is up to about a year old. What they found out, children that were sleeping on their bellies were more apt to have a SIDS death. And many, many, many pediatric hospitals did studies on it. I know where I came from, they did it and they still follow it in the newborn intensive care. They found a couple things that causes SIDS death. And actually it's males more than females. And of course it's sleeping on their bellies. It's being around smoke. So nobody should smoke in their house because the smoke can cause SIDS death. We tend to overdress babies because they're babies. They're going to get cold, right? Well, overheating can do that too. Breastfeeding is good. You have decreased in SIDS death on breastfed babies. It could be due to socioeconomic, it could be to no immunizations, and it could be co-sleeping, with the parents. Many things can cause it, but I've hit the highlights. And on the left side, you're going to see a apnea monitor. There are children, infants that come in where the parents get them and the little baby, for whatever reason, has what we call a choking event. And they call it an apparent life-threatening event, or they stop breathing, they turn blue, and they do a workup, find out what's happening. Is it reflux? Is it neurological? What's going on? And because of it, they send them home with an apnea monitor. Now, this monitor looks at heart rate and respiratory rate. And it's a Velcro strap with two leads that go around the chest, around the nipple line. And it is an ear piercing sound when that alarm goes off, whether it's too low, usually too low heart rate, too low respiratory rate, and it will startle the infant and hopefully wake up the parent too. So, one of the things that is universal in all children is motor vehicle safety. We know motor vehicle safety, we need to have our infants in the rear seat. We need them rear facing up to age 2, unless their height and their weight has outgrown the seat. That's when they can be turned around. Those little shoulder straps need to be snug, and we could take baby blankets and stuff them in, especially the younger ones where they can't even hold their heads up, right? We can support them with that. Another thing with as nurses and what we should teach is I think every mother, every parent should have at least a basic CPR. What if a kid chokes? What do you do? And this gives them a little bit of help until 911 comes, right? So Letitia is a breastfed infant being seen in the clinic for her 6-month checkup. Her mother tells the nurse that Letitia recently began to suck her thumb. Which of the following is the best nursing intervention? What would you do?
A.
It's it doesn't matter what they suck, does it?
C.
It's actually C. It's normal. Now, then they say, so when should they stop sucking either their fingers? My daughter was this finger backwards. That's what she liked. There's other kids' thumb. I mean, or a pacifier. What they say is it should be stopped and discontinued before they start getting permanent teeth. That is what the book says. Okay. Remember, children, infants, self-soothe themselves with their mouth. It's all oral. And how does infants and young children explore the world? Through their mouth. Everything goes in their mouth. So let's look at theorists. There's about 7 questions on your first exam on theorists. So I'm telling you the importance now. I'm going to try to describe what you should understand, and I'm going to start here. Now, Erickson, probably the most tested of all your theorists, okay? This is the one you'll see on HESI. This is the one you're going to see on your NCLEX, guaranteed. So it's one that you should pay attention to. Now, Erickson and the infant. It's all about the infant cries, somebody goes, picks them up, and takes care of them, whether to feed them, change them, burp them, or just love them. That's all it is. Now, mistrust, and it's when they have to wait, not just once, all the time. Nobody picks the child up. So this child has no trust. This child's not happy. His needs are not met. So an infant whose needs are met is a happier, healthier baby because they're not waiting for what they need.
I have a question.
Sure.
So when people are doing the cry it out method when they're trying to like transition their baby to sleeping on their own, is that recommended, not recommended, parents' choice?
It is a parent's choice. But the first year they're an infant, I know, do you spoil a child by picking them up too much or putting them down to sleep? I think putting them down to sleep, their needs are met, is different than having a baby cry and go and get them. I know what it is to try to put an infant to sleep. So Piaget is all about thinking, all right? So Piaget in the very beginning says, they have their hands moving around, their finger slips in and they suck on it and they go, "Ooh, I like that." Or they take and have a rattle that they grasp and all of a sudden they shake it, they like it, put it in their mouth. These are things that they had to first, by accident, something happened and they learned from it and they build upon it. So when you have an infant, what do we do all the time? We teach them, we show them, we look at them and we coo, right? And stick your tongue out and they try to do it at you. I mean, little infants, stick your tongue out at them. You're going to see them try to get it out at you. It's just part of cognitive, this is Piaget, teaching them what to do. There are different levels of Piaget. And what you need to know is number one, the sensorimotor. It's all about touch, feel, movement. That's all about, putting in their mouth, grabbing it, moving it. What does it feel like? And then in the mouth, because everything's in the mouth. Pre-operational now is, as I was telling you, they're sitting in a high chair and their sippy cup falls off accidentally. Mom comes, picks it up, and puts it down, said, "Here you are." Well, they've learned something. Putting that sippy cup on the floor got their mommy, so guess what? They're going to do it again. It also goes into taking a broom and riding it like it's a horsey, or taking a stick and it's a sword. It's all about using things to have fun or getting whatever their needs are. Now, as it goes forward, you have school age at concrete operational. Well, let me try to describe concrete operational. Well, if something's in concrete in your mind, you've seen it, touched it, felt it, you know it, right? So you can relate to it. So that's what you know, that's what you do. Formal operations, the adolescents, they don't have to see it, know it, touch it, feel it. They figure it out. I mean, I make always the inference to an adolescent who's been grounded, who wants to go out on that day, knows what they need to do for their mother to be able to go out. Nobody taught them. They figure out what they have to do. So it starts out with just, learning, how to put things in their mouth, movement, all those things. Then again, it's, learning initially it's toddlers, that sippy cup that fell. Then it's getting a little bit older, riding on brooms. It's a horsey, playing with sticks, now learning more. And at concrete, it's you already seen it, know it, and now you just do what you know. And then formal is figuring it out, getting what you want. So let's keep going. Why did that happen? We'll keep going until we get there. So one of the things with children is how they start to understand their body, right? So we start to know again, their mouth is their pleasure thing. One of the things that they learn that if they see something, even if it's not in sight, they need to go looking for it. Whether it's a younger infant, you put the rattle down next to them when they're on tummy time, they know it's there. They saw you put it there. They can't see it, but they're going to go looking for it. Or that toddler, that young toddler wakes up, knows that his toy truck's going to be in the toy box because that's where mommy always puts it, right? Object permanence. And then by 1 year old, they know that they're who their parents are and who they are by like even looking at mirrors and stuff. Attachment. When you have a young infant, they don't want to go to other people, so they'll come back to you. It's also part of that separation anxiety. Now, remember, 2, 4, 6 months, we're giving immunizations. Before that, we're also looking at them, weighing them, touching them. And it gets to the point where they don't want to go to anybody but who they know, mom, dad, grandma, grandpa, whoever they know really well. And when you leave, they're going to have a problem. Now, separation anxiety is 3 stages. It starts out, and let me give you an example of you have a child who's being admitted to the hospital, and let's say they're 8 months old, and mommy can't stay right now. She has to do whatever she has to do with her other kids. The kid's placed in a room, and the kid, when mommy leaves, starts crying. It's normal. They want their mommy, right? So they cry for a while. I mean, the nurse tries to calm them down, et cetera, et cetera. Knows what they like, what toys, what the comfort things they like, but nothing's helping. Eventually, they'll become quiet, and what happens is they regress. And especially older children, they regress. They'll start sucking their thumb where they haven't before, or maybe they're potty trained and they might, wet their bed. This is all that second stage. And then the third stage is, say mom had to leave for a day or two. And it happens. It's real life. Mom comes back, they don't even pay them attention. That's the 3 stages of separation anxiety. And then try to give your child to a daycare worker the first time. Isn't that stranger fear? They don't want to go. They're scared. They're crying. And it just breaks your heart dropping them off every day. You have to do what you have to do, but it's hard. We know their language develops. Their first thing is coo and crying. First thing they can do. And by 1 year, as I said, they're saying at least 1 or 2 words, mama, dada, or milk, whatever it is. And then, of course, children are always playing. So, toddlers. Toddlers, I think, are my favorite. These are, I love this Jerry Seinfeld. Having a 2-year-old is like having a blender without a lid. They're everywhere all the time at the same time, and try to keep up with them. It's just so difficult. These children are intensely exploring the environment. They are climbing on tops of the couches. They're trying to dive bomb onto other couches or on the hassock or on a pillow, and they're missing and they're hurting themselves and sticking fingers in electrical sockets and getting underneath cabinets and pulling everything out. Oh, toilet paper. That's one of the big things. The whole roll is gone. But this is a part of them learning now. This is the autonomy part, what they want to do. What are 2-year-old? Me, mine, I do, and do not want to share with anybody. Now, initially, I've talked to you about how quick they're gaining weight and growing. Well, from now on, everything slows down. Okay? Their birth weight quadruples. Now it tripled at 1 year, right? Quadruples at 2.5 years. So they really slowed down. Again, their head circumference should be equal to or less than their chest by now. Their body systems are starting to work. They're starting to be aware of their urine and their bowels, right? These kids are getting a lot of these communicable type kid diseases, upper respiratory, ear infections, tonsillitis, especially if a kid's in daycare. What do kids at daycare do every day? They swap each other's spit. This toy to this toy to this toy. And as clean and immaculate as all daycares try to be, it's still going to happen. Now, is it a bad thing? Not really. Because what's happening? That body is building up that resistance for the future, for when they get to school, they're not going to be out sick all the time. We know that at this point, you don't have to worry about wrapping them up if it's cold. If there's cold, they're going to want a shirt on. Now, at 1, they're attempting or they're trying to walk, right? Well, they're very awkward. They're waddling side to side. As they get older in toddlerhood, which is ages 1 to 3, now they're going to be more refined. They can throw a ball by 18 months, which I think is pretty cool. I know my grandson threw a ball younger than that, and it whizzed past my head. And if that would have hit me, I think I would have had a black and blue. I mean, it's, kids are wanting to do these things. At birth, each eye sees differently. It's called a binocularity. And by about 9 months, they start to work together. And that's all about depth perception. Well, by the time they get into toddlers, they're starting to see their depth perception is developing. It's a lot better. Infants are the pickiest eaters you'll ever meet. There are foods you can't try. I mean, as an infant, they're eating like crazy, aren't they? You can't tank them up quick enough. They want more and more and more, but they're growing quickly, right? Infants are not growing that quickly, so they become picky. Have you ever tasted formula? Have you ever tasted baby foods or cereal? It's pretty gross. It's really not full of flavor. They don't use sugar, salt, spice, nothing. So now, as toddlers, their palate is understanding that. They go through what we call a physiologic anorexia, as in they only eat what they want. 1 tablespoon of food per age per meal is all they need. And parents go, they didn't eat enough. He hasn't had enough to eat. We need to feed him something. Let's give him something to eat. And actually, they really don't need it. I mean, everything's evolving. Now, Erickson, remember I said these kids are autonomous, right? So Erickson says these toddlers, no, no, me, mine, all about me, don't care about anybody else. And they want to try and do everything. They're exploring. They want to jump on the couches. They want to be able to go into the cabinets underneath things. They want to do it. Well, what is mom and dad and grandma and grandpa doing? They're saying, no, be careful. Don't do that. You're going to get hurt. That's the shame and doubt. Toddlers should be encouraged to try new things. Let them, unless they're really going to hurt themselves, okay? It's just they learn that they can't, not you telling them they can't. That they don't understand, okay? So toddlers, they're trying. So these are all the stages. I said before on Piaget, we start with the normal stuff of the rattle, and now it rattles and it goes into the mouth, and the sippy cup, and then learning how to play with, a broom or a stick and learning that stuff. And then this is all part of, again, toddlers, same thing. So Erickson is all about me, figuring out, stuff, exploring, it's negative, me, mine. But how do you keep a toddler happy and not grumpy and well behaved? Well, rituals, as in routines. If you keep a kid on a toddler, especially toddlers, in a routine, they're happier. And as a nurse, if you have them in the hospital room, you want to know what their routine is. And the routine could be, what are they eating? What foods do they like? When do they take their bath? What do they do when they wake up? Do they eat right away? Do they get changed? All of these things, this ritualism gives them comfort, makes them feel secure. And that's the only way a toddler is going to be happier, especially in a new environment. I know traveling, when my kids were younger and even my grandson was younger, was pretty difficult as a toddler because you had to keep them on those same routines. Vacations can be really taxing on young children because you're going to be doing different stuff, eating different foods. Toddlers don't like that. As in Piaget, like I said, it's again learning, understanding, building upon. It's that active experimenting. It's okay, let me try that sippy cup. All right, let me ride that broom. Let me ride that, use that stick. It's experimenting and making it work, putting the hands up, flying around like birds or airplane. And then it's learning to use these things, and everywhere they go. Again, same things what I'm telling you here. It's, Erickson is autonomy versus shame and doubt. They want to do what they want to do, and the adults are telling them, be careful, don't do that. You're going to hurt yourself. I mean, it's being a parent, it's what we do, but we have to try to let them do it. It's that no, 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 me, I do, and all of that rituals. Now, when we go over, we can see all the other things here that it does. So that shame and doubt is just let kids try. Here's that sensor motor, like I said, the rattle, the sippy cup, and then toddlers tend to realize that they have different body parts. And I think this really starts by potty training, following mommy and daddy in the bathroom. It's what they do. Mommies and daddies don't have privacy at this point. The children are always walking in, right? You're going to see them touching themselves. And the important part with parents at this thing is what they say is to just say, if you want to touch yourself, go in your own room, go in the bathroom. I don't need to be watching you. Not to put shame to it. There's nothing wrong with touching themselves, but in the right place, right? Then, as they get older, 2 years old and more. Now they know there's boys' roles and there's girls' roles, right? There's girls and boys, mommies and daddies. We also know children developing themselves, getting out into the environment. You know, when kids do things, let them know that they've done a good job. Um, Also, children, as you get them into that hospital setting, know what they need to make them have comfort, especially when parents can't be there. My grandson Christian loved his blankie, a certain type, and he liked this one little toy that he had. It was a giraffe, and he called him Mr. Puppy. And if he had those things, he was happy. There's some children, a certain pacifier, a certain something that we know that that kid, it will help calm them, especially because parents might have to go to the bathroom, go to the cafeteria, etc. They're starting to understand more, but they can't express themselves sometimes. Sometimes you don't understand what they're saying. And they're getting frustrated just as you, because you really want to understand what they're saying. Um, they again, toddlers, they want to be independent, as in dressing themselves. Children should be able to feed themselves with a spoon by about 2 years old. Now, it doesn't matter if it's upside down or backwards, but they want to do it. They want to try, or they want to use their hands and smush it in their face. I know my kids, especially my son, he'd be head to toes in food by the end of dinner time. That's why I had bath time after dinner time because he love to touch and feel. There's nothing wrong with it at this age. They want to be independent. They're very strong-willed. Um, and then the other side of it is toddlers know when you don't feel well. If you're sitting there, I remember my knee was bothering me and I had an ice bag on it. And I still remember my little grandson, who lived with me for a while, came up to me and gave me a hug and a kiss and told me all better. They start to understand. Toddlers, you think they're young and don't, but they really do understand, especially those close to them. Now, play. Toddlers, as I say, don't like sharing, right? But they love to play and explore. They love cars and blocks and dolls and whatever. And they like to do their own thing. Don't touch their stuff, though. They are intense parallel players. If you had to guess what play does a toddler do all the time, guaranteed, it's parallel. They like to touch it. They like to fly things around, and they don't want to share toys. Toilet training, we know this starts. This is when they're ready, when they know when their bowels are going to go. They've expressed desires. And these children, all kids are different. Some kids are potty trained, by 1.5. Some kids aren't till 4. They're all different. So you got to give them that time to be able to do it. Know that bowel training happens before bladder because they can feel it better. We know there's always going to be issues with siblings. I had 6 brothers. I mean, we always were fighting against each other for something. And I'm sure if you have siblings, the same thing when you're younger. Toddlers now are going to fight bedtime. So you need bedtime routine to get them to bed better. Some parents, have to go in there and fall asleep with them every night. Some can just take them off, read them a book, turn the light out, and leave. They're all different. Again, no, 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 mine, me do, me do. And again, anytime a kid, toddlers included, when they are stressed due to whatever reason, they will regress where stuck in their thumb again, or being incontinent, or maybe they want a bottle again. You're going to see those things in this. As I said, nutrition, 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 right? They are not eating. This is what drives parents nuts. Physiologic anorexia. Now, if a parent came to you and said, I'm afraid my daughter, my son, isn't eating a lot, what would you do? Well, I would say, tell me, what did he eat yesterday? And that's a really good thing. Any food disorder, tell me, give me a food diary. Food diaries are where you start out with anything concerning food. In nutrition, whole milk might be offered to a child that has calcium and vitamin D problems, right? It's something we can give naturally. What if your kid had a wound or had surgery or whatnot, and is healing? Make sure they get enough protein, because what is protein good for? It is wound healing. And then, of course, there's always parents complementary alternative medicine. It's a lot of times it's cultural. It's not a problem with including that in medical care, as long as it doesn't interfere with that medical care. And as I said, sleep problems, usually it's putting them to sleep. Sometimes they wake up and they do have nightmares, night terrors, toddlers. My second grandson had night terrors and he would really be shaking. Sometimes it's talking with him, it's psychological. He ended up being put on something simple like melatonin, something easy to help him rest at night. But kids, they do have night problems. Again, dental health. They should be brushing their teeth with a soft toothbrush. After the age of 6, they should be flossing. Up to that, they don't know how to do it. They don't know that dexterity yet. But they should be brushing their teeth minimum before they go to bed in order to get all that day's sugar off of it so it can prevent those cavities. Children love to put everything in their mouth, right? They like to go up to windowsills and bite on them when they're teething. What if it's an old building? Could have lead paint in it. And that is an issue in some areas. So knowing that. Now, what happens if, let's say, New York City, Chicago, big cities. You're in an old apartment building, and this child is acting weird, seizures, things, and they determine that it's lead poisoning. They need to go through a process to get that lead out. It can, if it continues, can cause death and really bad cognitive problems if not treated. And how do we get rid of lead? Well, there's chelation therapy, there's oral medications, and there's also a machine that they can use called apheresis if we need it pulled off really quick. So, making sure that they don't put these in their mouth. And then I will tell you, anytime a parent thinks that their child's eaten something that's not right, the first thing before you never induce vomiting on a kid until you call poison control. Poison control should be a number on every discharge, whether it's from a doctor's office, urgent care, or hospitals, something that should be there for them. They like everything. Medications, they like those vitamins, those Flintstone chewables. Oh, they think they taste good. That's okay, but what if it's Tylenol? Tylenol can be dangerous. It's hepatotoxic, right? Can kill the liver. And again, always call poison control. And we don't use Epicac anymore. Okay, that's something from a long time ago. What we do is we call poison control. They could say, have them drink milk or whatever, and get them to the nearest center. As I said, always motor vehicles going to be a big injury promotion. Drowning should be something that we teach as safety for, young children. Now, my grandson stayed with me for the first 3 years of life, and I've said this before. And I do have a pool in my backyard. Now, by age 2, that kid could do a front flip in the pool, no swimmies. And yeah, his head would be floating up and he'd with his hands, but he knew where the sides were. He knew how to be safe. But that child would not, he did it once, go in the pool by himself without asking. And he's 7 today. He will not. He'll ask first. Drowning should be taught, water safety should be taught, in the neighborhoods because of this. And I live in South Florida, so it's really evident here. Burns, big thing where they pull pots off the stove. Kids are always falling, like the toddlers jumping where they shouldn't. Those plastic bags, right? These things should be looked at. Car seats, as I said, should be front facing. Um, Good shoulder harnesses should be there. Again, using those blankets to hold them in place, to have them snugly. And they don't turn around till 2 years unless they've outgrown them by height and weight first. Now, gross motor skills, these are your toddler stuff. Throwing the ball, I told you 18 months. Fine motor improved is going to be that 12 to 15, and the refinement is the ages 2 to 3. So now you're preschoolers. Preschoolers are ages 3 to 5. Preschoolers is where we start the faces scale, right? For pain. Preschooler, we're trying to get them ready for school. So, should we do? Well, number one, these children, reading to them, showing them colors and numbers and, really starting getting them ready for school, being able to sit and listen for a period of time, and parents should always have that good attitude towards learning. Again, they're not gaining much again. Very slow, very, stair step sort of thing. We know that their body systems, again, they can hold their urine longer. You can take a longer car trip without them having to say, I gotta go pee pee, mommy, right? Stop the car. Well, no, by preschool, they can hold a little bit longer. Gross motor, they're able to walk, run, climb, jump, 3 to 6. This is an age where, first of all, they're able to take and walk and run and jump on a foot and By the time they're 6 years old, they're playing hopscotch and riding a bicycle, right? Age 3, they're riding a tricycle. So a lot of differences change. Fine motor, it starts with, writing, then getting up to writing circles. 4 or 5, they're able to fine motor, put the buttons on their shirts. And again, they're starting to dress. Now, a 3-year-old might be backwards, but a 4-year-old might get the shirt correct. They might start learning where the labels are to do it right. But as they learn, they're going to get it more and more refined. Erickson. So we've had autonomy versus shame and doubt. We've had trust versus mistrust. And now we have our preschoolers, a sense of initiative. Well, this is a time where they like to do stuff for you. This is the time where they like to help mommy do things, right? They're starting to understand, when they're anxious and they have fear and they can verbalize these things. In Kohlberg, where they're going to start learning that right from wrong, as in good consequence or, punishment, right? Punishment and reward, we call it at that point. In cognitive development, what do we need to do? Again, like I said, get them ready for school, give them that good learning and read to them. And kids should be out socializing, doing things together, like playing t-ball, learning a game, learning how it works, when to run, when to walk, when to catch it, where to throw the ball. These are all learning cognitive things. Piaget, I've already started talking about what it is, using things for different stuff. Um, they're starting to listen now a little bit more. Their language is getting better. Their concept of time. Now, even a 6-year-old doesn't know at 4 o'clock we're going to go to the store. But if you tell them when you wake up from your nap, we're going to the store, right? Or after lunch, or after dinner, when you wake up, when the sun comes up, whatever it is, that's their concept. They don't know the time on a clock. They don't get that. They don't understand it. And have you ever heard a kid at this age play? It's all about talking to themselves and making things work, and having things flying and building up little things. All about magical thinking at this age. And they're able to follow simple commands. Put your shoes by the door. Put your dirty clothes in the laundry. Take your plate, put it on the kitchen counter. All of these things. Like I said, Kohlberg, this is all about right and wrong. You know, um, again, this is punishment and reward. This is all about the toddler, the preschooler. They're starting to really know about their bodies. And I call the age of band-aids, right? They get a boo-boo, they're bleeding, put a band-aid on it, it's all better. You know, but one of the things that happens, have a preschooler get a cut and it's bleeding a lot, they think their insides are all going to come out and they're going to die. This is just the way they think. So it's important, for instance, you have a child, let's say they need surgery of some sort, let's say an appendix, which is not uncommon, to tell them their insides aren't going to fall out, they're not going to bleed to death, and they're going to be okay, and they're going to put a band-aid on it when they're done. Band-aids are the cure-all. They don't like needles. They don't like things that go into them. So you've got to be really careful with those explanations. Today, especially if we're working in a hospital setting and you have the opportunity to work in a pediatric facility, you will see children um, that you'll have child life explaining procedures to them, touching the stuff, and it does help them. They're starting to understand boys and girls. They're starting to understand blonde hair, brown eyes, blue eyes. dark skin, light skin. They're starting to know, if they're heavier, they're skinnier, they're tall, short. They're starting to see differences in people. Fowler talks about faith, right? That's one of the theorists. And what they know is what they've learned from their family. If they've gone to church, then they'll know the whole story. But there are other families that they'll just know a Christmas tree and Santa Claus comes, let's say for Christmas, right? Or whatever other religion. I mean, we just said Easter. Maybe they only know Easter Bunny. But it's all what is taught to them by the family and what they've been told. Now, one of the things that they do believe is if they get hurt, they fall down, they get sick, they think they're being punished. And this goes on into early school age too. They think that an illness that God is punishing them. And if you're going to be in pediatrics, one of the things they get sick, you're going to say, You didn't do anything wrong. It's just that, let's say it's the appendix. Well, the appendix didn't want to be there anymore. Or you fell down, you tripped. It's okay. You didn't do anything wrong. Well, I hit my sister. I this or that. And, this is what they believe. Again, they're starting to look at sexuality. They're starting to dress up like their mommies and like their daddies. Again, they're going to play house. There's sexual exploration. And again, and especially if mommy's going to get pregnant and they're at this age, they're old enough to say, So, how did that happen? So the one thing that it should, as nurses, because it will happen to us, well, where do you think it comes from? And then play on them. What do they know? They don't need to know the whole details. That's not what they're asking for, okay? So a lot of these things like stranger anxiety is getting better. They understand when mommy, daddy leaves, somebody's coming back. Mommy and daddy still need to watch over and keep them safe for sure. Again, that security, especially if they're going to be placed in a hospital, is those familiar objects. Whether it's a teddy bear, whether it's their favorite pillow, blankie, whatever it is, it does give them that good old familiarity and security. And again, play therapy, that child life specialist, that's the person that will come and say, What are you afraid of? I worked in the cardiac intensive care unit for 10 years, and a lot of the kids had to come back for second, third stages. Child Life would work with them. They knew they were getting chest tubes. They remember them from before, IVs and the breathing tube. They'll let them play and touch things so they won't be afraid of them. What to be expected? What do noises sound like? They are better to know than not to know. Their language, they're starting to talk up a storm. You can't keep them quiet at this point. They just want to talk, 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 talk. And their vocabulary from ages 2 to 5 is completely different, right? And some words they come up with, I have no clue how they got there. They're really smart children. They do not need to be as ritualized as the toddler. Toddlers are the rituals. Toddlers are the ones that are parallel me, me, mine, mine. Preschoolers are not like that. They don't need as much of that rituals. They're more in playing with other kids, associative play versus that parallel play. They want to dress themselves, they want to please, like I said. Again, all they know is their family. They really don't know much more, so it's the culture of the family they know, but they're going to start to test it. I think part of it has to do with what they can do, what they can't do when they can do it, and they'll challenge it. It could be going to bed, what time? Do they go to bed or staying up later? It could be what they should do, clearing the table. He needs to change it. The other, clear the table. The other brother, the other sister. All these things are going to be challenging. Play, as I said, more of associative play. They like playing together. As they get older and understand how one wins a game, then they'll get into that cooperative play. But it's associative, it's imaginative, it's imitating, and then dramatic. They can play out what's happened to themselves. We can use that for many different reasons, whether a bad experience that they've gone through in a hospital or maybe some abuse. We can find out. Preschoolers don't like the dark. There's always a ghost in there. They like the lights on. They do not like to be alone. Ever be in a house with a preschooler and you go into another room or walk outside for a second? They're inside screaming and yelling, and crying. Where'd you go? They're afraid that somebody's going to hurt them in their private parts. And they're afraid of objects or people associated with pain. Guess who that is? The nurse, right? We always go to them with a needle. That's why we should do everything to decrease the amount of pain that they'll get. Again, sex education, find out what they know before you start giving them an input into it. They do at this point, as again, they find themselves and fondle, and they do get to the point of masturbation. Again, that should be in their own private place. They doesn't need to be here next to me. Go somewhere else. And then, of course, the fears, like I just said. We see a lot of problems with speech, and this is when speech therapy is usually instituted. This is where we see kids who are not speaking or stuttering or stammering and all of that. And again, the earlier we get it and get them into therapy, children are resilient. They catch up very quickly. Again, sleep problems, like I said, nightmares, terrors, these happen. Again, that bedtime ritual is very important. And, right before we go to bed at night, watch a movie, read a book, calm down. Don't be outside running around swimming, come in, get dressed, all right, time for bed. It's not going to happen. Injury prevention, using proper equipment. Again, motor vehicles, being careful. We know that at this preschooler, these kids are more agile. They're in the driveways, they're chasing balls, they're in parking lots, whatnot. They're going to be hit by cars. It is an increase when it gets to that preschool time because they are more agile and they're more active and they're out there. So when we're talking about children, um, and starting to teach them, we know that children like to be in groups and learn together. Um, and they're going to start, and when they get these teachers, they're going to be put in preschool, and even kindergarten at age 5, right? And they're going to start saying, well, my mommy said this, and my mommy said that. And it's just part of what they do. Communicable diseases, there are some things that occur. We know chickenpox is a big one. We know that the flu, upper respiratories, ear infections, um, influenza, right? These things all happen, and knowing how to take care of them. Now, since the institution of, we have more immunizations that we've ever seen. We know that, influenza vaccine, rotavirus vaccine, pneumonia vaccine, all of these things do help. Now, one of the things that we still see, even with immunization, is children with chickenpox. And we know it's right before they break out in a rash is when they are contagious. Now, once they broke out with their rash, they must be put, into if you're in a hospital, let's say you're working in an ER, you need to put them in a reverse airflow. But this is airborne. Did you know that chickenpox was airborne? And as a nurse, you're suspecting. What would you see in chickenpox? You would see a fever, you would see an itchy, burny rash, and you would see different sorts of oozy, juicy macules and papules, right? put a mask on, an N95, get the child as soon as you think it could be, better safe than sorry, and get them into that isolation room. And that isolation room doesn't put air back into the hospital. It filters it out so that the chicken pox, can't be spread throughout the pediatric population, okay? And other things that we as nurses, we always check immunization status on children so we know where to place them in the hospital. Conjunctivitis is a big thing, right? Kids always getting the goopy eyes. Nursing care, you clean them, remove secretions, and you put in the drops. Remember, if you put ointment in, tell the kid the vision will be blurry, right? And then once it warms up, it'll be fine. I would always tell the parents with children with conjunctivitis to change their pillowcases because they're going to go back the next night, put their head, or the next day, next nap, and put it right back into that infection. Something that I did myself, and I think it's a good thing. Children, stomatitis, all those things around their mouth, again, it hurts. Again, if it's oozy and juicy, to keep them isolated and decrease the pain. Now, what would you do if you had pinworms or roundworms? Now, pinworms are children, and these kids are out in the dirt playing with their trucks and whatnot, right? And pinworms could be tiny, like 1 millimeter, 2 millimeter long. How would you know they have it? Well, what they say is these children will have more symptoms at night. What you're going to do is take these kids in the night, you're going to go into their bed with a flashlight and a piece of scotch tape and put it on their anus and take it off, and you probably will see a worm there. Put it in a container and send it off for evaluation, and then they will give oral medications to take care of it. And if one person has it, everybody should be checked because it goes around that easily. Child neglect, child maltreatment. I would like to tell you that I've never seen it, but I have. I've seen physical neglect, I've seen emotional neglect, and I've seen it where they withheld food or water. And it was not something I'll never forget. So, one of the things about child neglect, especially if a kid comes in and they're telling you, oh, they fell down the stairs. Well, when the symptoms, the signs that they're showing you don't match the story, that's usually a neglect. Now, who's responsible for reporting neglect? We are. We're nurses. We're going to tell the charge nurse. We're going to tell. I had one kid came in who had a fractured skull. And when I picked this 3-month-old baby up, my hand squished into the scalp. And I went, and I gently, it was behind the ear. I had to weigh the kid first, right? And I was like, ooh. And it was purple, yellow, and green looking. I had a suspicion. I told the doctor, and I personally took him over to X-ray and did a CAT scan, found the fracture, and then we did an X-ray, what we call a bodygram. A 3-month-old fits on one X-ray plate. We found a fractured femur, fractured ribs, and a fractured humerus on a 3-month-old. And his twin brother, which we called in later, also had it. Oh, and the 2-year-old that was also a part of him, he had a fractured femur he was walking on. So those children are now safe, okay? But it was because I questioned it. Your responsibility at all times is to protect your children. I will never forget those little twins. Today they're safe. The perpetrator is in jail. That's all I'll say. Another thing is mush housing. Ever hear of it? It's when parents tend to make their child sick for the attention. You'll see things like feces being injected into IV tubings. or instead of cleaning wounds with, soap and water peroxide, putting other dirt in it, it has happened. And it does happen. And it's this kid is always sick. Like, what's going on? And you can't describe all what's happening. These children, your responsibility. If you suspect mush housing, what you need to do is have somebody in the room next to that kid all the time when the parents are there. You need to protect the child again. So, maltreatment again, take care of it. Now, some of these things are sexual abuse that somebody else did, and parents are bringing them in. Remember, parents are going through heck themselves. Your kid gets sexually abused, you need support also. So, 3-year-old daughter and a male cousin of the same age have been inspecting each other closely as they use the bathroom. Which of the following is the most appropriate response by the nurse? What would you tell these parents?
D.
You neither condone or condemn. Just say, come on, let's go. Let's get something to eat. It is normal for children at 3 years old to look at each other. It's part of their curiosity. Now, if it's going beyond that and doing more things that are totally inappropriate, yes, there's other stuff. They're probably abused.
Right.
Okay. But if it's just normal, just looking at each other, touching, this is normal stuff that goes on. Again, come on, let's go. Let's get to the other room. So let's go for a Kahoot. Let's try to get through that. We got a few of them. Any questions at all so far? I redid a lot of that PowerPoint to make sure I covered a lot of those concepts that are on the exam. So I would always tell you to go back and review PowerPoints and Kahoots. All right, as you're coming on, I'm going to get going so we can get out of here on time. Infant, toddler, preschoolers. A multi. Types of play considered to be sense pleasure play. I'll think about what the words say in sense. In that senses, in that touch, feel. Playing in the sand, finger painting, mashed potatoes. Checkers is not sense. That's a game, more of a cooperative play. The nurse noticed with white patches in the mouth of an infant that cannot be removed with a tongue blade. What should she do? Now, I can't cover everything in a PowerPoint, so I put some things in the Kahoots to introduce these to you. Now, it's probably, where they have thrush, right? Ungo is what the Spanish population say. And if you can't get it off, it's going to need some nystatin liquid on there. And what you do is you take a cotton swab on an infant and rub it on. You don't inject it in there, you just cotton swab it in there. What type of play is considered cooperative play? Remember, cooperative play is between two or more children and somebody wins. That's the difference there. And it's playing checkers. It's not sharing, that's associative play. They're sharing together. Playing checkers, somebody wins. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning. What did I tell you about Kohlberg? Actually, I think Kohlberg of all of the theorists is the easiest one to remember. So, understands actions are good or bad and they have a consequence, whether praise or punishment, right? Which nursing action is appropriate to teach a preschool child about a scheduled procedure? You have a kid who's coming in, let's say they need to have their tonsils taken out or they need to get a CAT scan. And preschoolers, they're smart enough. They want to know what's going on, right? And that absolutely, number one, how do you approach any child? First, get down so you're not towering over, get on their developmental level, and you can always use dolls, showing stuff, show them the equipment, let them touch it, feel it, play with it. A multi. What are some findings from a pediatric physical assessment? So we have histories and we have physicals, right? Physical is what you can touch and see what's going on. Growth, breath sounds, bowel sounds, temperature. History is different. It's not physical assessment. Before performing a physical assessment on a toddler, the nurse should be to do what? To encourage cooperation. First of all, when you want to go in, as I said, you're not going to go in and touch them right away. Number one, get down on their level. A toddler, maybe say, ooh, do you like Batman? I've got a sticker. Or, ooh, I see you have a shirt. Or you got sparkle shoes.